Good morning. I'm privileged to have the opportunity to launch Organ Donor Awareness Week 2021. Given the challenges we all continue to face in staying safe during the COVID-19 pandemic, it's fitting that this important event is being launched online this year. Organ Donor Awareness Week represents an important opportunity each year to spread and to reinforce the message of the life-saving role played by organ donation and the enormous improvements in the quality of life it brings to recipients and to their families. I'm delighted, therefore, that the event is going ahead this year. Despite the challenges faced by everyone involved in organ donation and transplantation during these extraordinary times, I'm delighted that it's been possible to maintain organ donation and transplantation services throughout the pandemic. In 2020, a total of 156 transplants were carried out. 98 kidney transplants were performed at the National Renal Transplant Service, Beaumont Hospital. This figure included 77 deceased donor kidney transplants and 21 living kidney donor transplants. 32 liver transplants and 4 pancreas transplants were performed at the National Liver Transplant Service in St. Vincent's University Hospital. And 14 lung transplants and 8 heart transplants were performed at the National Heart and Lung Transplant Service at the Mater Hospital. This is a great achievement. It's a testament to the professionalism and the dedication of all the intensive care staff, procurement staff, surgical teams, medical teams, and nursing teams. In particular, I want to acknowledge the great work of all the staff in Organ Donation and Transplant Ireland, the 3 transplant centres, and the intensive care staff in our hospitals. I want to thank the organ donation nurse managers who are working tirelessly on the ground in each of the hospital groups, promoting the benefits that organ donation brings to recipients and building enthusiasm among the hospital teams for organ donation. I'd like to thank the staff working in intensive care units in hospitals across the country for the incredible work that they're doing in treating our COVID patients, and also for the important role they play in the transplant process. Their initial contact with families in the most difficult of circumstances is an essential part of the donation process. Of course, without the generosity of the families who selflessly agree to the donation of their loved ones' organs, organ transplantation could not happen. Their support for the donation process is truly an act of altruism which takes place without reward, without recognition, except for the comfort they take from the thought that their loved one's last act was to save the life of others. To all of you, I extend my sincere thanks. I understand that Derry and Sally Ann Clark will be sharing their donation story with you later today. Thank you for your generosity in sharing the gift of life with others at a time of immense sadness for your family. I also want to thank the other participants who are sharing their organ transplant stories with you here today. I hope that their personal testimony about the emotional roller coaster of being on an organ transplant waiting list and the transformative effect receiving an organ transplant had on their lives will encourage others to become organ donors. I want to particularly thank the donors of the Living Kidney Programme for their huge generosity in giving the opportunity for life-changing transplantation to recipients. The positive impact that organ transplantation can have on the life of a recipient and the lives of those around them cannot be overstated. We all have a duty to do everything we can to ensure that as many people as possible benefit from organ donation. As Minister for Health, I am committed to building on the continued progress we have achieved in the area of organ donation and transplantation. I want to ensure that Ireland ranks amongst the most successful countries in terms of the proportion of the population who donate organs, the number of recipients who benefit from these donations, and the subsequent improvement in the quality of life of organ recipients. My department continues to work with Organ Donation and Transplant Ireland, intensive care staff, and the transplant hospitals to build upon the achievements of recent years. Incremental improvements to our organ procurement service will continue to be achieved through improved infrastructure in ICUs, implementing a more robust organ retrieval service, and through transplant centres maximising the conversion rates from donor opportunities that are presented. Additional funding of €750,000 is being provided this year to support this ongoing development and improvement in our organ donation and transplant services. The funding will ensure that our organ donation services are equipped to meet expected additional demands following the introduction of an opt-out system of organ donation as part of the Human Tissue Bill, the enactment of which is a priority for this government. The legislation will be accompanied by a publicity campaign aiming to raise awareness of organ donation and to encourage people to make a decision that they wish to become an organ donor and to share that decision with their loved ones. Ultimately, the aim is to make organ donation the norm for people in this country. I want to thank Colm McKenzie as chairman and the recently appointed Carol Moore as CEO, who took over from Mark Murphy in 2020 after 20 years in the role, and all their colleagues in the Irish Kidney Association, who have been at the forefront in promoting organ donor awareness. Thank you also to all organ donation and transplantation support groups for your unstinting work in supporting individuals and their families, including the Irish Donor Network. Organ donation is among the most selfless acts we can bestow upon another person. I would ask that during Organ Donation Awareness Week, everyone would consider becoming an organ donor and, just as importantly, sharing this intention with their loved ones. In this way, we can increase the possibility that on one's death, your organs may be used to give someone the opportunity of life, and that loved ones will have the comfort of knowing that your wishes were carried through. In conclusion, I reiterate my commitment to work to increase organ donation and transplantation rates to the benefit of patients and their families. I wish Organ Donor Awareness Week every success and want to thank everyone involved for your efforts in making this week possible. With the continued successful rollout of the vaccination programme, there are better days ahead for all of us if all of us share our intention with our families to pass on the gift of life. There will be better days ahead for those waiting for organ transplant also. Thank you.